As we've been reporting, we still don't know the motive behind the killing of the CEO of United Healthcare. But the shocking crime has sent a chill throughout the insurance industry, the health industry in particular. It comes as many Americans are voicing their frustrations over coverage denials. Now, one insurer that has nothing to do with United Healthcare is reversing course suddenly after facing major backlash for trying to cap payments for anesthesia in the middle of operations. NBC's Ann Thompson is following this story. And what happened? Which insurer is involved? And how did they think that they could get away with this?
Well, Andrea, the insurer is Anthem Blue Cross Blue Shield, and what it wanted to do and proposed this back in November was to limit the time it would pay for anesthesia care, put time limits on anesthesia care. And it wanted to do that in 3 states, Connecticut, New York, and Missouri. Now, as you can imagine, once this idea started to get some publicity, the backlash was furious. New York Governor Kathy Hochul called it outrageous, and Connecticut's comptroller, Sean Scanlon, who controls the largest health plan in that state, basically said, "Over my dead body." I also talked to some doctors, and one of them, Dr. Gregory Levitin, who is a vascular birthmark surgeon at Mount Sinai Hospital here in New York. He said it just didn't make sense because doctors, when they're operating, first of all, the surgeon controls how long the anesthesia goes on, not the anesthesiologist. And secondly, the doctors are focused on the patient, not the clock. Here's what the doctor had to say.
Is this even workable in surgery?
I don't see how this could be applied across the board. Anesthesiologists do not control the amount of time that is spent under anesthesia. A surgeon who is well-trained has a protocol or step-by-step process for performing a surgery. It's not something that's time-dependent, but it's technically dependent.
Now, in abandoning this policy, Anthem issued a statement yesterday explaining why it reversed course. First of all, blaming what it called widespread misinformation about its policy. And then it went on to say that it never was and never will be the policy of Anthem Blue Cross Blue Shield to not pay for medically necessary anesthesia services. So it was, when I talked to the state controller at Connecticut yesterday, Andrea, I asked him what caused this reversal, and he really said it was people speaking up because people were just outraged at this idea.